everybody, and welcome to this week's show of Rock and Recovery. My name's Carol Michelle,
And my name is Carly.
and today we have a very special guest on the show. We have Adam Bello.
How are you?
I am very well, Adam. How are you?
I'm great, thanks.
I am so glad that you're here.
Well, thank you for the invitation to join you. This is an important issue, an important topic to talk about, and so it's my pleasure to be here to share what I know and some upcoming plans that we have to help people.
So, in case somebody doesn't know,
Mhm.
you are the Monroe County Executive.
I am.
Yes.
So I was elected county executive last year, and so I just started earlier this year in that role. And before that, I was the Monroe County clerk and then the Irondequoit town supervisor before that.
Yeah,
Yeah.
well, that's
Yeah.
one
I
of the
appreciate
things that you talked about
Mhm.
as your platform was the need for addiction services.
Right. Yeah. See, one of the things that, had become clear to me for years, and if you even just back up on a broader sense, is that one of my frustrations in the county is that we have so many good people doing such great work in many different areas, whether it's in dealing in education or in poverty or many different areas. But in one of those areas is in addiction services and treatment. But those services aren't really coordinated in a real comprehensive way as best as it could be. So like you have all these folks that are operating in silos, are doing great work, but if we can leverage all the resources that people have, that they're pouring into these challenges facing our communities, leverage them and then expand them. You can, 1 plus 1 doesn't always have to equal 2. We can make it equal 3 here. And so what I wanted to do is in meeting with families, people who were facing addiction and in recovery, and when I'm meeting with individuals who are in recovery, it became clear to me that the issue is still affecting way too many people in our community. We've lost way too many lives in this community to just accept the status quo. And so this issue, just like every other issue, I think requires a great deal more coordination. It requires a lot more effort and resources. And that's a place the county can play a role, because the county government touches so many different parts of our lives. Again, it's parks, it's transportation, infrastructure, public safety, public health. We touch all these different areas, so we are uniquely positioned to be able to coordinate all those various departments, all that various funding that we put out into the community and services with all the nonprofit communities in the service and the great deal of work that you're doing, and help coordinate in that way so that we can expand the services that we provide. So this was a real important piece of the campaign last year, was making a commitment that the county will invest additional effort and resources into the opioid crisis, because this is a crisis that we're facing. And then this year we made a number of plans that we could talk about today to really put action to those words, because at the end of the day, we can talk about plans all we want, but we really need to start acting to help people in the community.
I couldn't agree with you more. And I have to say, you have a great team at the county.
Mhm.
Corinda Crossdale, we love her.
Yeah.
Dr.
We do.
Mendoza, we love him.
Yeah.
You have a great team to work with.
Yep.
And everybody has like good common sense initiatives and stuff going on where they want to help the people.
100%. I mean, we have great public servants, and one of the things that I learned in my transition into this job was that we have a lot of talented people in county government, but we needed to unleash them so that they can go and get the work done, right? And we have a lot of talent, a lot of great ideas. And so putting Corinda Crossdale is a deputy county executive for me for Health and Human Services, and then Dr. Mendoza, that team working together to help create this opioid impact team that we're going to be launching here in the next few weeks, I think is so important. And because those are the professionals. One of the things that I'll readily admit as a county executive is that I don't know everything, and about everything. But what I do know is how to bring people together and how to coordinate activities. And I think what I like to think I know is how to find good people. And so we have to listen to the experts. We have to listen to people who are involved in the community, take their advice, take their resources, take their experience, and unleash them to do good work. And that's what we've done with working with Corinda and Dr. Mendoza. I think Dr. Mendoza has done a fantastic job working with us through the coronavirus pandemic and COVID-19. And even though that's taken up, frankly, most of our time over the last 7 or 8 months, we have been able to move forward on our plans for the opioid crisis. We have been able to impact other issues in the community. You just don't hear as much about it because it's overshadowed by COVID-19. But we really do have a great team there, and I think they're doing a great job reaching out into the community and coordinating efforts.
There's an initiative that was, it was actually legislation passed by the governor about Narcan. And he's saying now that the Good Samaritan law is going to be in effect for businesses as well.
Okay.
So restaurants and movie theaters and stuff don't have to be afraid of having Narcan. They don't have to worry about liability of any sort. So I think that that's a huge, wonderful thing.
I think it's that's a significant development, and I think the availability of Narcan around the community is important, right? And this is what's going to save lives. And so the training that our health department offers and does for the community and for the business community, and that coordination, I think is great. And I think that we need to invest more in making Narcan more available, so that life-saving support is where people are, right? Because if it's locked up in an office somewhere, it's not helping anybody out in the community. So it needs to be more available, and that's why So I'm proud of the training efforts that we have, but I also am grateful to the state and the governor for making that change.
Everybody, thanks for staying with us on Rockin' Recovery. So we are here today with our friend Adam Bello, and you're sharing with us what's happening at the county level regarding fighting the addiction crisis that we're in right now.
That's right, and we talked about last year that I made a commitment to this community that we would increase our efforts from the county in terms of just the coordination efforts, the manpower, and the resources available to the community. And we talked about hiring a position to help coordinate those efforts. Some people refer to it as like an opioid czar or a director or something like that. But the more I learned about the issue, and I worked with Dr. Mendoza and the team and a lot of advocates like yourself, we had conversations about how is the opioid crisis really affecting families and people, and how can we best serve them, and what's really the best use of our resources. And what we discovered is that it's more than just opioids, and it's more than just one person. What we're really going to do in order to have the impact that we want to make, so it's more than just a press release, it's more than just something that sounds good, but it's actually going to impact people's lives. It's more than just one position. So what we did was earlier this year, we created an entire opioid impact team legislation and plan that we worked with the Department of Health on. We worked with folks who are in recovery, folks who are providing support services, got a lot of input from people, and we went to the county legislature back, I think it was in April, and asked them to approve a new position, which is an addictions director. So it's a director of addiction and treatment here in the county. So it's a high-level, cabinet-level position that's going to report to me. It's going to be housed in the Department of Health, though, so it has access to the Department of Health and all the resources and data and information there. And that director of addiction will lead a team that also includes a research analyst, because data is going to be very important here to be able to track where are addictions recurring, what types of drugs, where are they coming from, how are people, you really get right into the granular details of what's happening, so that we can take our resources and direct them in the most effective way. And then to help coordinate that effort, we're bringing on an initial investment of 6 community coordinators. These are essentially navigators that can go out into the community and work with families who've been impacted by addiction, work with individuals who are in recovery or are seeking to be in recovery, or are in the throes of addiction and don't know where to turn but are looking for help and want to get out. And so it's to help provide that path. So go back to something we talked about before, which is that there's a lot of resources. There's a number of folks offering programs and peer support. I think of places like Recovery Fitness that is offering that peer support, and also that other outlet through physical activity. And you have you have addiction and treatment centers. You have inpatient, outpatient facilities. You have all these things. they're not coordinated in a really good way, so that if you're in the throes of addiction or you're looking to get out or you're a family, I'm a father myself, and I think about, what if one of my children were in that position? Where would I turn? Where would I go? Right now it's not entirely clear. But if you have community coordinators that can go out and meet with families and meet with people and help understand what is a tailored, unique program to you. Is it mental health treatment? Is it inpatient, outpatient? Are we looking for peer support? And then be able to tailor and match you to the service or the treatment that you need. So it's really building out a whole team. It's not just one position, which is something we could have done because that's what I said I would do. But that's really governing through press releases, and that's not something I'm interested in. I'm rather governing through how do we make the impact. And I think the impact is going to be in the coordination of those services. And also be able to step out so you have real professionals coming too. So it doesn't just necessarily have to be handled by law enforcement to do that follow-up, but it can be followed up by somebody who is experienced in mental health services, social worker backgrounds, things like that, that can then help coordinate that. One of the frustrations I have is that, you can drive around and, like I said, lots of people doing great work. So it's, we have the infrastructure. It's just putting it together. Where is that, Adam Bello size billboard, letters on a billboard with the hotline number? Where do you call, right? That are around our county, so that it's in your face and that resource is right there when you need it. We need more of that. We shouldn't have to Google and search through 7 or 8 websites or pages to find that true support. It should be readily available, in the community.
When you say that, I have to go back to a conference I attended, and Adam Barria was there from Google. He's a legal advisor for Google.
Okay.
And he was saying that Google was frustrated because people were trying to find addiction treatment and Google stuff about, different things as far as drugs go or how to help family members, and they could tell by their algorithms that people would give up after a couple of clicks.
Oh, interesting.
Yeah. And so even Google is having problems with that.
Yeah.
And that's why we have to be where people are, right? So
Yeah.
Google, I'm glad they're taking a look at those algorithms. I also look at when, you look at the Buffalo Matters project or, initiative in Buffalo, where, they've been able to coordinate and streamline a lot of the medical assisted treatments for people that aren't as readily available here in Rochester. When if you overdose and you end up in the hospital and you wake up and you're ready, and that's the point where we have to get you. If you're ready and saying, I need a better way, I need a better path, and I'm ready for help, that help needs to be there, right where you are. It can't just be a pamphlet and a spreadsheet of 6-point fonts of all the different places that are open and what their hours are. That's not going to work. The access needs to be right there where you are. There needs to be someone, a navigator sitting with you that says, okay, here's where the beds are available, here's where the appointments are available, and then nobody should leave. Wherever you are, whether it's an urgent care center, whether it's a hospital emergency room, nobody should leave until that appointment is scheduled. If the medication, if it's available and required or appropriate, is given to you, and you have that path. Just sending someone out with a pamphlet and a pen on the back isn't going to work. So we want to model that Buffalo program here in Rochester as well, and that's something that our impact team is going to be able to work with our hospital systems here to do that. And I'll also go back to when we talk about COVID-19 and a lot of the impacts that that's had on the community. One of the positive developments in that is that it's helped us as leaders in the community to build capacity to be able to do that. So what I mean by that is that, you look at treatments for opioids and how I talk about, it's like a lot of things, it's very siloed, right? What it's done is COVID has helped us to bring people together very quickly. So we have 2 hospital systems, Rochester Regional Health and University of Rochester Medical Center. They're competitors, right? Those are competing systems. But because of COVID-19, they've come together to work together. We had them through the pandemic on the call every single day with me and my team, coordinating all of our efforts. How do we coordinate the surge capacity? How are we doing this? But by doing that and developing that coordinated approach, we're building capacity to then work on other issues of public health that are facing the county. You know, when you work with the school districts and in those conversations about whether school closes, which we all did together earlier this year, and now as schools opening, how do you work on the issues? You're building capacity within those school systems in the county to deal with larger issues. And so one of the side effects of COVID-19 is it helped our community build that capacity to have a greater impact on issues such as the opioid crisis that's facing our community, so that we can do a better job. We even successfully were able to bring together local governments through a lot of this. You know, regardless of political party, you know, Democrats, Republicans. I know politics can be hot, especially a year like this in a presidential year. But you know, throughout the pandemic, we had conference calls every single day that I was on, where we gave updates. We had every leader across the community was welcome into the call. And they were able to ask questions. We had dialogue about what was going on and what the strategy was. And it was really, again, breaking down those barriers, bringing people together, and building that capacity for the future. So while we faced a lot of challenges because of COVID-19, and we should talk about the impact that has had, I think, on the opioid crisis, it also has helped us to build that capacity.
And as you know, the numbers are up. People are using more. And it's not just opioids. It's
Correct.
all kinds of drugs and alcohol.
Right.
And it's had an impact not only on, you know, deaths, but domestic violence and child abuse and all kinds of stuff.
Yep, and that's why the addictions director was so important, because it's greater than just opioids, like you said. There's also alcohol and other substances. But one of the challenges that we've had over the last several months, and you just mentioned that the numbers are going up. We had for a few years the numbers heading in the right direction. One of the effects of COVID-19 though is it's turned that around, and the numbers started heading in the wrong direction again. And I think the reason why is because of that social isolation that we're feeling. People are stuck in their home, they're isolated. It's not as easy to reach a peer to seek that medical support from folks. And so that's having that negative effect where we're seeing the increase in the overdoses and unfortunately fatalities in our community. And that's and COVID has done that on a number of issues. You know, you look at, you just mentioned domestic violence and child abuse. The reports are down, but my fear is that they're not down because it's not happening. It's just not being reported. And so we need to do a better job as a community now of figuring out, okay, how do we still maintain physical distancing that we need to have to keep the virus low, but move past the social distancing and the social isolation? How do we still reach out and be able to connect with individuals to get the help and support that you need and to services? But COVID's really had this effect of accelerating problems and exacerbating a lot of problems. So opioid crisis existed before COVID-19. COVID-19 exacerbated the problem. Just like we've had economic problems before COVID-19 is exacerbated. We've had issues of education inequality in our community, and this has exacerbated that issue. The other thing I would point out related to the last several months too is that the other thing COVID has done, and this is why the community and everyone watching this program should step back and think about life from other people's point of view and really think about having empathy for other people's situation. And I'll give you an example. There are plenty of people who are watching the show right now who continue to collect a paycheck through the shutdown. They continue to be able to educate their children from home. And so the real effect has been, and they're not facing addiction issues or things like that. So they're really, the effect of COVID is they felt some isolation, but in some ways they're probably saving money because they don't have childcare costs. There's no place to really go out and spend your dollars. But then there are other people whose entire lives are crashing down around them. Their life savings are gone. Their jobs are gone. They do not have the infrastructure or ability to educate their children from home. They have issues in addiction, and then you layer on top of that the social isolation, and now they have some severe healthcare issues that are life-threatening issues. And it's hard sometimes to see life through other people's lens, and I think we lose that sense of empathy sometimes, particularly when the politics of the day are so hot and you have such extremes that are being faced from this. So I think one thing that we need people to do is to step back, think about how the last 4, 5, 6 months have affected yourself. How has it affected my neighbor? How has it affected people I don't know? And then reach out and talk to your friends, talk to your family, talk to your neighbors, and find out how you can help. If you're in a good situation and came through this, that's great. But why don't you reach out to your neighbor, reach out to your family who might be struggling, and find out how you can help.
I so agree with that. And like, we might be physically distant, but
right.
I feel like I've reached out to more people the past few months.
Yeah, right.
That, like, people that I haven't talked to in a long time. And I think
Sure.
everybody's just a little like excited to like pick up the phone or pick up the text. And I think too, it's like in the beginning of all of this, I remember saying, check on your extroverted friends.
Right.
We're not okay right now. Like, this is a real challenge.
Right.
But it's so
Yeah.
true. I mean, you speak a lot of truth when you say that.
Yeah, well, thank you, and I think that's something that it's going to impact everything in the community now with schools opening. Some people are sending their children are going to go right back to school, and it's going to look a lot different, but they're going to send their kids to school. Other people don't have that option. The school's at home, and then how do you balance home with work? And that's going to create stress that is then going to again exacerbate other issues such as drug addiction, alcohol addiction. These stressors are going to impact those issues, and so we have to still continue to be mindful of that, and not be afraid to reach out to someone who is struggling and ask them how you can help. And that's why we're now increasing our efforts on this. So in just the next couple of weeks, we'll be in a position to put this team in place. These new 8 people at the county. That we're really proud of this effort, but the county's going to do its part to bring in an addictions director and a whole community service team to be able to go out into the community where the community is to provide those services, but we also need the community's help too to be able to identify people who are struggling and provide that help and that support and again that contact with a peer, which is going to be very important. As we get to, as we try to get people into recovery.
I love the way you described the plan with the impact team. I love the language of it, impact team, right?
Yep.
Sounds like heavy duty. And then it reminds me of like boots on the ground.
Right.
Like they're going to be out in the community because we have to tackle this with every muscle that we have, right?
We do. We do. It's not acceptable. The number of people who are losing their lives in our community, it's not acceptable. Especially when we have so many resources available in the community.
Yes.
And that's where I struggled to figure this out last fall before I was the county executive. Was how do we have all these resources, but we're still not quite getting it right? And it's like, I think it's that coordinated approach. It's being in the community and it's linking people with those services. So I'm hoping that this has an impact. I'm also one of those people, I really don't have a lot of interest in just press releases and programs for the sake of having programs. We got really good at, we're program rich sometimes and results poor. I think what we need is one thing I say to all my department heads in the county, no matter what it is that we're doing, is I say, how is that going to help somebody? Who's that going to help? What's the impact of anything that you're looking to do? Because if you can't tell me how that's going to impact somebody, whether it's child daycare dollars, subsidy dollars, SNAP dollars, emergency assistance, or it's transportation, whatever it is, then what are we doing, right? We have to question what it is we're doing. So this is, I think, a step in the right direction.
We have to go to a break.
Oh, cool. Okay.
Hi, everybody. This is Carol Michelle from Rock and Recovery, and I am here with Carly and our friend Adam Bello.
Hi, how are you?
Very good. So we've been talking about what's happening at the county, and we are so excited about the plan that you're rolling out. And I was wondering, now we were talking about like the hospital systems and having maybe somebody there to help somebody who needs treatment.
Mm-hmm.
What about the family members?
Right. See, I think that is just as important because the family members are, I think sometimes they're just as impacted, and a lot of times they're the first line, I think, of treatment or of getting someone into treatment. You know, I think about it through the prism of the fact that I'm a parent, right? I have 2 small kids. You know, what am I going to do? What would I do if it's 2 o'clock in the morning? I wake up and my child is passed out on the front lawn, and I've had enough, and I don't know what to do or where to turn. You know, it shouldn't be a difficult process as Googling and saying, I don't have a half hour to just Google, you know, what to do. Obviously, I'm calling 911 and I'm getting emergency medical treatment. But where do I go? What do I do? There are programs that exist here, and I think also is partly where the peer program can come into play too. There are families who face issues of addiction and have family members in recovery or have lost family members and have been through this. And we need to connect with other families in the community.
We have to go.
Wow, this went by quick.
Well, thank you so much for coming on the show.
Oh, it's my pleasure. Thank you for the invitation. It was really great to share this information with you, and this conversation is important.
Wonderful.
Yeah.
So we will see you next time on Rock and Recovery. Bye.